What systemic diseases cause dry eyes? Imagine your eyes as windows to your health, revealing clues about what's happening inside your body. Several systemic diseases can cause dry eyes, often because they affect tear production or the quality of your tear film. These conditions usually involve autoimmune responses or widespread inflammation that interfere with how your eyes stay moist and comfortable. One of the most common causes is Sjögren syndrome. This is a long-term autoimmune disease where your immune system mistakenly attacks moisture-producing glands, including those that make tears and saliva. When these glands are damaged, tear production drops significantly, leading to severe dry symptoms. Sjögren's can occur on its own or alongside other autoimmune diseases like rheumatoid arthritis or lupus. It's considered a primary cause of dry eyes caused by reduced tear volume. Rheumatoid arthritis is another autoimmune disorder that primarily affects your joints but can also impact your eyes. It often occurs with secondary Sjögren syndrome, which further reduces tear production. The systemic inflammation from rheumatoid arthritis can also directly irritate the surface of your eyes, making dryness worse. Systemic lupus erythematosus, or lupus, is yet another autoimmune disease that can cause dry eyes. It damages tear-producing glands or causes inflammation on the surface of the eye, leading to discomfort and dryness. Like rheumatoid arthritis, lupus involves widespread immune activity that can affect multiple parts of your body, including your eyes. Thyroid eye disease, often linked to Graves' disease, is a condition where your thyroid gland becomes overactive. This can cause your eyelids to retract and your eyes to protrude slightly. These changes can lead to incomplete blinking and increased exposure of the eye surface, which speeds up tear evaporation and causes dryness. This type of dry is more about evaporative loss rather than a lack of tears. Diabetes mellitus also plays a role. High blood sugar levels can damage tiny blood vessels and nerves that help regulate tear production and maintain eye surface health. This damage can cause your tear film to become unstable, leading to dry, irritated eyes. People with diabetes may also have a weakened immune response, making their eyes more vulnerable to infections and inflammation that worsen dryness. Other systemic conditions linked to dry eyes include Parkinson's disease, which can reduce your blink rate, leading to faster tear evaporation. Androgen deficiency, which affects hormone levels, can impair the function of meibomian glands that produce the oily layer of tears, resulting in evaporative dry. Scleroderma, an autoimmune disease causing tissue fibrosis and inflammation, can also affect your tear glands. Ocular rosacea, although primarily a skin condition, can cause meibomian gland dysfunction, leading to dry, flaky eyelids and increased tear evaporation. It's important to remember that dry eye disease often involves a mix of factors. Some people may have both reduced tear production and increased tear evaporation, especially if they have multiple systemic conditions. For example, autoimmune diseases tend to cause aqueous tear deficiency, while thyroid problems and neurological disorders often lead to evaporative dry. Understanding the underlying systemic disease is key to managing dry eyes effectively. If you have a systemic condition, your eye care professional can help tailor treatments that address both your eye symptoms and your overall health. Always consult with healthcare providers for personalized advice, as each person's experience with these diseases can vary. Proper diagnosis and management can help improve comfort and protect your vision while supporting your overall well-being.